And here is your question.
Good evening.
Okay, so if you have read and understood, considering it communication skills station, kindly begin.
Good evening.
Yes, good evening, doctor.
I am Dr. Jahan, one of the surgical doctors here. Can I confirm that I am talking with Mr. Evans?
Yes, I am Evans.
Nice to meet you, Mr. Evans. Today, I'm here to talk about stopping your medication Warfarin. Could you please tell me about your concern, Mr. Evans?
Yes, I have a hernia and operation is planned because it is recurrent. And my doctor told me, as I am on blood thinning drugs, warfarin. So my doctor told me continue it, and you people are telling me to stop the warfarin. So I am very anxious. Why are you stopping this tablet? It is life-threatening for me.
Oh, I understand your concern, Mr. Evans. So, could you please tell me that do you know what the mechanism of action of the medication warfarin? Do you know anything about that?
No, I don't know. I just only know that it thin the blood
Okay.
thinner.
Okay, so let me explain you first. This is so the warfarin. It is a medication we use to thinning of the blood as you have a history of surgery of your heart bulb, right?
Yeah, yes, I understand.
So that's why we are using this medication warfarin so that no blood is going to clot in your body. Okay.
Yes, I understand.
That's why your doctor has been prescribed you to take warfarin, not to stop any dose. But as we are going to do a operation on her, if you are going to take this warfarin, then the blood thinning property will be remain on, and there will be bleeding during and after the surgery. So it will be
Yes,
difficult for us and for you
I
also.
understand.
Are you getting me? Okay, Mr. Evans. So that's why we have to stop the drug, stop this warfarin 5 days before your
So you are
surgery.
continuing the warfarin? Yes.
Yes, we will continue the warfarin after you regain your blood thinning property. When we use the medication instead of warfarin, it is heparin, and it is injectable, and it has the same working property like warfarin. But before operation, we have to stop the warfarin 5 days before the operation. But for heparin, we have to stop it 12 hours before the operation. There's the difference there.
Okay, I understand. Why the heparin? What is the of heparin? Why it is necessary? So can I resume this warfarin after the operation?
Yes, Mr. Evans, you can continue it, but after the operation, we have to ensure that your INR. Do you know what is INR is?
No, I don't know.
So INR, it is a test we do the people who are taking warfarin regularly. It is a investigation, blood investigation to do. Then we will do the INR, and when it is within normal limit, when we can see that your body is recovering the blood system, then we will stop the heparin, and we will resume to continue. So we will continue the drug warfarin as the usual dose. Are you getting me?
No. You are telling that when you gave me the heparin, will do the test INR.
No, when you are finished with your surgery,
Okay,
then
okay,
we
I
will
understand.
test the INR. Yes.
Should I stay in the hospital for this heparin? I can go home.
Okay, Mr. Mr. Evans, it is I understand your concern about this. As we have to give you this injectable heparin, you have to stay in the hospital because it is, first of all, it is an injectable drug and it have to be given by the experienced nurses, and we have to monitor you. That's why you have to stay in the hospital, I'm afraid.
Is there any option to stay in the home and get another treatment instead of heparin?
If you want, then we can talk with the social work service. Then they can allow us to give you an social nurse, and social nurse who will give this injectable heparin in your house, and we have to contact with your GP that you are taking heparin in house. Is that okay to you?
Yes, I understand. I think about it. I will think about it. Is it necessary to stop my anti-anxiety medication before the operation?
You can take it in the morning of your operation by sips of water.
6 hours before
Sips
operation.
of water.
Sip of
Sip.
water.
No,
Sips of water
sips
and
of water. Yes.
in the morning of the
In the
operation.
morning. Yes.
Okay. Okay, thank you. I understand.
Mr. Evans, is there anything that you want to ask me?
No, I understand what are you saying. I understand fully that I will get the heparin.
Okay, so Mr. Evans, can I summarize everything what we have been talked through?
Yes, sure.
Okay, so you had a surgery, mechanical heart bulb replacement. For that you are getting warfarin, but now you are going to have surgery for recurrent inguinal hernia. That's why we have to stop the medication warfarin and bridging it with the injectable heparin. And after the operation, we will resume warfarin when you are taking orally, and that's why I am here to talk with you about this. Thank you so much for your cooperation, Mr. Evans. We're all here to support you. If you have any inquiries, just let me know. I will give my number to the nurses. Don't hesitate to ask any questions. Thank you for understanding, Mr. Evans.
Can you tell me after operation, how many hours I will resume the warfarin? You told me the INR
after
you
the
will check,
operation, yes, after the operation, the injectable heparin will continue. Then we will do the test INR, and if it is in the normal limit and you are allowed to take medications orally, then we will resume the drug warfarin again.
Okay, I understand. Thank you. Doctor.
Thank you. You're welcome, Mr. Evans. Have a nice day.
23 seconds are left. All right, good. Yes, how can we make it better?
Yes, ma'am. I think Dr. Kaur has left some questions, why heparin and something else. That's why I haven't explained the bridging, what did
You
say?
did kind of, but yeah, no.
Yes, I can. Yes.
My
good presentation.
Good. It was good. She's
Comprehensive.
getting, yes, better every day. And then what I wanted to say, yes, doctor. Someone has
Yes.
yes.
Yeah. Good evening.
Good evening.
Good evening, doctor. That was quite a very good presentation. The conversation flew. It was quite fluent, and
Yes.
it was well directed. It was well directed and straight to the point. She did so well.
Thank you so much, doctor.
Yes, she answered most of the questions, and then they were all in layman's terms. Most of them. It was quite very clear. So, but I have question. Do we have to admit a patient in the hospital? I don't know how they do it in
Yes.
the UK. Do
Yes.
we have to admit a patient in the hospital just for the purpose of giving them heparin?
In this scenario, the patient is blind and living alone, right? So since the patient is not capable of taking care of himself, so you'll offer the patient, that patient can be operated, that patient can be admitted, and you can arrange social worker, you can arrange a nursing care assistant with the help of involvement of general practitioner, and you can also arrange with the nursing manager and the nursing services to see, just to make sure that they take responsibility of providing or taking care of responsibility of this heparin before admitting, in case patient denies
Okay,
or
okay.
refuses to be admitted. So patient,
Okay.
since is living alone and is of a has a disability, so yes, you will offer the patient to be admitted, but you cannot force.
Otherwise,
Okay,
patient will go home.
so
Patient-
definitely, if the patient goes home, so then that's when I would then liaise with the social workers and then the GP,
Yes,
and then get health extension to go and be giving the patient the drug at home.
yes,
Okay, okay, thank you.
yes,
ma'am.
that's
Thank
right.
you.
Yeah, good. Thank you.
I'd like to ask Dr. Tanzina, how
Yes.
do you go about the deal with this patient about his cataract or blindness?
Sorry, I didn't get your
Empathy.
point.
Yes, because patient is blind and once you will
Mhm.
greet the patient, how would you greet the patient? How would you deal with the patient's blindness? By giving equal respect or equal.
Yes, I will show him the empathy, or I
How,
will
how?
ask him more. I will
How?
ask him more that he's getting me or not.
No, but what he wants to know, I understood what his question is. How would you reassure the patient that you are there first, once you will enter?
Yeah,
Because he can't see.
that's the thing. How
Yes.
do you reassure that you are talking to him?
Yes.
By calling him name, by his name.
Okay. One, you addressed him with his
I'll
name.
use this your phone for this one.
Secondly, you'll
You need
ask
to
the
go.
patient if
no
light
problem.
is bothering him or not.
You
If he's
won't make
sitting
me do Kindle.
comfortably, if he's being bothered, then
You know-
you can maybe ask him to, okay, if it's bothering you, I can turn it off. Then you can offer him before you start your conversation. Patient should be feeling comfortable, right? If he's sitting comfortably, if he knows that your presence is there and he can feel it and he understands it. And then you have to take it like this slowly. And then here, you maybe not have to touch him, but you have to make him realize that you are there nearby and you are there to talk to him.
Madam,
Okay.
will the candidate reconfirm the age of the patient, although it is given in the scenario?
Yes, you can confirm, just like she confirmed. Okay, can I confirm if I'm talking to Mr. Evans, and can we know how old are you? You can confirm it like this.
Again, ask the question that how are you?
So
How
is it
old are you?
necessary to ask about the age?
You have to confirm the name and age for all the patients until unless patient is admitted patient. Then you are supposed to know the name of the patient, but you still have to confirm the age.
Okay.
Yes, Dr. HK, you want to add anything?
So that's the thing, that you have to make sure that your presence is there with the patient you're talking.
And the light.
Yeah, and the light.
Yeah, good.
So I have to ask him about that. Is the light is bothering you, Mr. Evans, or what?
Yes.
Are you comfortable? Should I switch
Are
off
you
the light?
comfortable?
Mm,
Okay,
yes.
okay, right.
You have
Yes.
to. He probably would say
it's a
no.
very,
That's all right, but still you have to ask.
yes, it is very essential question to ask.
Yes.
Yes, I agree.